Our journey begins here, in the heart of rural Uganda. From bustling cities to remote villages, this is where our story starts. Uganda, land of beauty, resilience, and community. But for many in rural areas, access to quality healthcare remains a challenge. In these communities, non-communicable diseases like hypertension and diabetes often go unchecked, making daily life an uphill battle. But hope is on the horizon, and it comes in the form of the PULESA Uganda project. We begin our story here at Nakawuka Health Center III, one of the 16 sites where the PULESA project has been rolled out. The project brings a new approach, integrating treatment of NCDs with existing HIV care, making healthcare more accessible, more efficient, and more human-centered. Meet Masibirunji, one of the patients here at Nakawuka Health Center. She is one of the beneficiaries of the project. This is what she has to say.
Amanya gange nze Masibirunji. Najja bankebelanga nina pressure. Bangapekebelanga simanyi nti njina ne mbagamba bwe baweeri tewali kizibu nina pressure ne batandika okumpa eddagala ne ndimira. Okusaya kakati lyennimira ndi bulungi. Sina kyenina mu kupira. Era nungi gye nnina entunnunsi tezikyankuba nnyo. Balina kye bafunyeemu. Waliwo nejjo bwe bakebeddeko wano ne babagamba mutambulire eddala nga ekyo kye mutambuliddemu mugire bulungi eddagala. Naffe abali bawo tufune amaanyi agakolera ddala omulimu ogwo oguli baweera ddala. Kadi etuyamba kubanga baatugamba mutu bw'oba tonatuusa kiseera kijja eno osobola okufunako w'ogenda ne bakupimako ne balaba bweyimiridde pressure. Ya pressure kyendigambako beerale nnyo beeralire ddala era bagendere ddala n'omulimu ogwo batuyambye kubanga twali tetumanyi. Mwebale nnyo mwebalire.
Nadula Doreen is one of the healthcare providers here at Nakawuka. She's the one that measures the blood pressure and also prescribes medicine to the patients that come to the hospital.
I'm Nakawuka Doreen. I'm a clinician here at Nakawuka Health Center III, majorly centered in Art Clinic, and we do everything at incorporating NCDs at the moment. That's what we are mostly doing, incorporating NCDs into the clinic. So when patients come on a normal clinic day, we do health educate them. We give health education about NCDs, and then we help them like to identify, because some of them have symptoms but they may not know. So we help them identify them through the health education. We help them identify the symptoms. So when they come on the clinician's table, they are able to tell us, give us a bigger picture of the problem, and we examine them. But we do triage. We take their BP, take their random blood sugars in case it is needed, examine their mental health and everything, alcohol and depression, and then we go through. In case they do not have any problems, we can then dispense the art drugs. So before we had PULESA coming into the system, our patients we used to just diagnose and give them what we have, which was not so much readily available. So, and even the testing wasn't being done so much because we had only one BP machine by then, which was being used at the outpatient department. But then when PULESA came in, we got a BP machine. We can now do our own BP monitoring of our patients. So we have patients are receiving that service. At least every patient that comes into the clinic is able to be monitored for BP, and that is why we are not really diagnosing that much, because even the monitoring wasn't being done so much. And even including giving us the drugs that they're giving us have helped our patients so much. Reason being that they're better than the drugs we were being given at the facility, because we are being given bendroflumethiazide and nifedipine. And for our patients, of course, with the not monitoring plus the drugs not being readily available, we weren't really helping the patients a lot in as far as hypertension monitoring is concerned. And now we have the drugs. Our patients, after explaining to them, have understood the burden of hypertension, and we are able to help them to control their hypertension. Right now, we realized actually after starting like taking patients' BPs that we even had more patients than we expected. At the beginning, we were told to get around 25 patients in a year. We right now have more than 25 patients, and at least I'm happy that over a half of that has controlled blood pressures. And even for the patients that are having higher than that are not controlling, they are still helping us with the health education. So we are very grateful for the PULESA project. You've helped our patients a lot. Our patients are happy. I wish the clinic, they could be as many. They would tell you that they are grateful, their pressures are controlled, and the drugs that you're giving us are very, very effective, because out in the market they're actually very expensive. They are very expensive for the patients that have tried to go and get them in the market. They've told us that drugs are very expensive, but for someone to go out of their way and give them to us for free, we are very, very grateful. Thank you so much.
Nakawuka Health Center, another key site for PULESA, is one of the many facilities that has embraced its integrated care model. The impact on both patients and healthcare providers is profound. We speak to a patient and a healthcare provider, and they tell us their story.
Kale amanya gange nze Barwane Peter nga ni mutuuze w'ebbanga era nga nkulembera Nakawa. Nebaza ekitongole kino ekya PULESA Uganda nti nze bwe najjira wano ennaku PULESA yali nga nsumbuwa ng'ali haayi. Naye nazimba amagulu, nali nga zena zalisobola kutambula, naye bwe nafuna information wano nga ngambye nenzijja wano ennaggulu batandika okunkolako. Since batandika okunkolako enjawulo weeri, wakati bankebera nga ali mu 180 ofa 120 130, naye kati mu kiseera kino yonomalizinga nada mu 130. Bwe natandika okubeera nti nfuna eddagala byenjizeemu nti wabeerawo counseling. Counseling omuntu alina okubeera nti weeyisa otya, okubeera nti pressure wabeera nti anomalizinga tagenda high. Kale counseling yoka enyambye nnyo, era nsaba ku pressure okubeera nti ngimanaginga, kubeera nti mmera eddagala olunaku daily. Omusawo ebiragiro byangambye byakugambye byolina okukola. Bagamba nti 1 times 1 mira 1 times 1. Sigamba nti ate olwaliro oyoseemu ate ennaku oyoseemu, nedda. It is a daily basis, mbeera nga mmera eddagala lyange, era kyekinyambye okubeera nti pressure wange abeera nti anomalizinga, n'okubeera nti kati balinawo am free. Enkubirwa omulanga abalina abalwadde ba pressure bonna mu point esooka balekerawo okweraliikirira ennyo, okulowooza ennyo, okwesaako stress. Kugamba buli kimu bakitwale maina. Ekintu ekirala jasi beekwase Katonda, nti Katonda yasobola mu byonna buli mu mbeera. Katonda yawonya. Abasawo baffe batukolako naye nga kusinga Katonda yawonya mu byonna. Ekirala tugobeere instructions z'abasawo batugamba. Bagamba nti mira eddagala bunaku limire. Bw'olivaako jjukira nti obagenda kuddayo mu mbeera gye waddamu eri. Kale mbakubeereza nti tugobeere amateeka abasawo ge batugamba. Ekyokubiri tumire eddagala lyaffe. Ekyokusatu tuleme nnyo okweraliikirira ennyo, okwesaako stress. Buli kintu kitwale easy. Ekyokuna eddagala we liri wano enaggulu ku kitongole kyaffe kya PULESA Uganda PULESA bagaba eddagala lya bwereere, era tibajja tere musawo agenda nze kasooka nzija teri ansaba nkuwadde n'ekikumi, tebansaba n'olwataano. Eddwaliro lyaffe lyajja ekitongole kino ky'abantu abanaku abatalina ssente. Kale mujje mwegatte ku Uganda PULESA, mujje mujjanjabibwe, mubeere bulungi, mutwale banka. Ensi tukyabagala, Katonda tukyabagala beere nga mu nsi nga tuweereza.
Gloria Kalule, a clinician who works at Nakawuka Hospital, also shares her experience with the project.
I'm called Gloria Kalule. I'm a clinician here in Nakawuka Regional Referral Hospital. We are 2 clinicians here. one is the doctor in charge, and I'm the second in command. And I see most of the patients in this clinic. The PULESA project in this clinic is an initiative that started some time back that has helped a lot in this clinic because we have over 500 clients with NCDs, and most of them have the hypertension. And when the PULESA project came, we started with a training, and then we started the implementation. And by then, we didn't have a formula to use while we were managing our clients with NCDs. But when it came, we got a formula, we got SOPs, and now we are at the same page. We use the same formula, all of us, to manage our clients. And we are stocked well with the drugs. And by then, we were giving drugs here and there, and the clients were not able to buy the drugs because we didn't have them in our pharmacy. But when we got when the PULESA project came along, our clients are able to get their drugs in full, and they're taking them. It gave us the first training as all of us in the hospital, here in the art clinic, but we were able to call everyone in the hospital, even on the medical ward. Then later they come along, the staff comes along, the doctors come along to check, to see whether everything is being implemented well. They come to mentor, they come to supervise, they look into the patient's files. They're even able to talk to the patients, the hypertensive patients. We have a clinic day. Our clinic days for NCDs is every Thursday of the week. Okay. So, and that's when these staff of the PULESA project usually come and see these patients. We give health education talks on the lifestyle management, on the need of adhering to hypertensive and diabetic drugs, and as well as the art drugs. Yeah.
Speak to Kabatongole Doreen, a study nurse who works directly in the project. She shares how she works under the project, and she shares her experience with what the project is doing.
My name is Nakawuka Doreen, and I work as a study nurse on the PULESA Uganda study. And under the PULESA Uganda study, this is a study that is integrating HIV with hypertension. And we are in 16 facilities, that is in Kampala and Wakiso. I work in the 8 facilities, and those include there is Komamboga, there is Saidina, there is Butabika, there is Nurture Africa, there is Nakawuka. And in those 8 facilities, 4 facilities are implementing one arm, that is the hypertension plus, and the other 4 facilities are implementing the other arm, that is the hypertension basic. The hypertension plus arm, here we provide these facilities with the hypertension drugs, the BP machines. We do on-site mentorship, we do trainings, we do performance improvement programs, as well as giving them the baseline training. So we do continuous monitoring and giving feedback to these facilities, and also keep monitoring how they are performing. And for the basic, which is basically the standard of care for these facilities, we do the baseline training, we give them drugs and support them with BP machines and the other equipments they are using, and we leave them to implement on their own, and we just give them just limited support. So we are comparing these 2 arms, the H10A plus and the basic, to see which arm actually yields the best, and which one we can, if we are to give, if we are making analysis, which one would recommend I've seen that patients whom we have interviewed in the longitudinal study have really given us an insight that they prefer these services being integrated than having these clinics separated, all clinics that are apart, because this will it helps them reduce on the transport they are spending, the time, and also the many visits they have to make. So with the integration, patients are really appreciated also having their hypertension drugs being given to them at no cost, and also knowing their BPs, and also for the H10A plus, we encourage these patients to take their BPs at home. So when they come back, for the patients we have interviewed, you really see they are really taking good control of their lives. So we believe and we know in the near future this will yield something, and patients will be in control of they will be in control of their health. Yeah, that is all I can say. Thank you. Thank you very much.
The PULESA Uganda project has done more than just integrate healthcare. It has transformed lives. By bringing together HIV and non-communicable disease management, communities once burdened by distance, costs, and limited access to care now have the opportunity for healthier, fuller lives. But beyond the numbers and the statistics, the true impact of PULESA lies in the relief on a mother's face, in the confidence of a patient who knows they can manage their condition, and in the commitment of healthcare workers who are empowered to provide holistic care. This is just the beginning. With dedication, collaboration, and continued support, we can create a future where high blood pressure, diabetes, and other non-communicable diseases are no longer a silent threat in Uganda. Together, we can build healthier communities and end the battle against hypertension in Uganda.